So in terms of talking about the medications, it's important to talk about the baseline or background risks for many of our patients because it's often interpreted that if there's an exposure to medication and something bad happens, that it's because of the medication, but there are many other variables that have to come into the assessment of risk. So major malformations are actually quite common in this country, about 3 to 4% according to March of Dimes and CDC data. There's a major malformation or birth defect in at least 3% of pregnancies in this country. Now, I think that that's easy to forget, especially for pregnant patients, because it would be terrifying to get up every day during a pregnancy and be thinking that something has such a great chance of happening during pregnancy with a poor outcome. So I think there's some denial around this, which is totally understandable. But in terms of our ability to assess risks and benefits, we have to appreciate that the baseline risk is definitely not zero. The rates of prematurity in this country, which is just a major complicating variable and increases the risk for babies greatly of many different problems. The rate of prematurity is about 11 to 12% nationally. Rate of gestational diabetes is conservatively cited as 2 to 7% here, but it's higher in some populations, especially as the risk of obesity is increasing among women of reproductive age. Untreated psychiatric disorders have almost all of them studied have shown to be associated with an increased risk of obstetrical complications. So, for example, prematurity and other complications. And of course, you can imagine that having a severe illness, like being psychotic or being manic or being depressed, those impair a woman's ability to care for herself and may also increase the risk of someone engaged in reckless behavior or harming themselves or committing suicide. So of course, carry great risk.